Welcome, everybody. This is a beautiful day God has given us. Welcome, TJKshares, one-on-one with TJK. This is a place where we bring you transformational people. We bring you conversations that will build you up. We learn, relearn, and unlearn together. I'm excited today to have one of our own people from Uganda. We took you to Israel, we took you to India, taken you all over the world. We come back home where it all started and where most of the work I've done in my life still lives. Today we have Daraus, my man, who is going to tell us a little bit about himself, and we'll get to hear more about this young man. Daraus, welcome TJK, and please tell us a little bit about yourself.
Thank you, sir, and for the invitation. I'm glad to be on the TJKshares, a YouTube channel. My name's Daraus Bahikire. I'm a Ugandan male, aged 33 years now. I'm a born of Rengo district, born and raised in Rengo district. And that's my place of birth, and that's my home district. Bahikire is a teacher by profession, professionally a teacher, actually of biology and chemistry. Yes?
Yes.
Yes. I happen to have studied Bachelor of Science with Education, Biology, Chemistry from Bara University. I also have a master's degree in public health, specifically health promotion.
Yes.
I also have a postgraduate diploma in public administration and management from UMI. I also have a certificate in administrative law from Law Development Center, Uganda. But actually, Daraus, just like I earlier mentioned, I started my career as a biology chemistry teacher from one of the good schools around, Gombe Secondary School.
Okay.
Yes. And then I carried on to join Ministry of ICT and National Guidance as a research and communication assistant, specifically handling the health sector.
Yes.
It was interesting. It is interesting that in the Ministry of ICT, there is that area where the research and communication is divided into the different areas, and me, I was responsible for health sector, looking at how the performance of the health sector, what are the different programs and initiatives around, and communicating, doing health communication basically on behalf of the government. From there, I joined the Ministry of Health as a public health specialist, and specifically doing health promotion.
Yes.
Health, you can say health promotion specialist. And I served in that particular role for about 4 years. So maybe I'll somehow talk about my role in the Ministry of Health, basically doing health promotion. Health promotion, where you have social behavior change, you have risk communication and community engagement. And most of you are seeing messages on COVID, on Rift Valley fever, on Ebola. That is part of the health promotion.
Yes.
Now, but when I was in the ministry around 2018, when I was deep into health promotion, I personally realized there was a gap in behavior change, in disease prevention.
Yes.
So me and a few colleagues ideated and came up with what we called Advocacy for Behavior Change by then as an organization. But of course, we started as a company limited by guarantee by that time. So we formed what we call Advocacy for Behavior Change. Now, I realized that I couldn't have time to do civil society work and also do the government work. So I had to take it up and now concentrate on civil society work, on advocacy for behavior change. But last year, we realized that we needed to change the name to make it a bit, more comprehensive and inclusive, because behavior change is a small bit of health promotion.
Mhm.
So we actually changed the name to Purpose Healthcare Africa, where we have a number of thematic areas. We have behavior change, we have research, we have risk communication and community engagement, we have advocacy for health, and many others. So that is how now advocacy for behavior change now turned into Purpose Healthcare Africa, which you now know on Twitter and everywhere. That is Bahikire Daraus, and I am the founder, I can say, and also working as the executive director.
All right, that's a good introduction leading into the conversations we are going to have. Daraus, tell me, you became a teacher. Was it your choice to become a teacher? Was it your parents who told you be a teacher? Or how did you become a teacher? After you answer how you became a teacher, tell us the transition from teaching in a classroom to becoming an advocate and educating the public about health.
Maybe my inspiration of becoming a teacher is can be traced from around 2003, when I lost my stepbrother from HIV/AIDS. My brother, actually, not my stepbrother, my brother. So what came into my mind was, what could have caused this HIV? Was it intended? Was it acquired? Because by then I was somehow young, and so the whole thing couldn't be conceived right well. So I'm like, I think I need to interest myself in how I can, help my generation to understand, and also get to know that actually this caused this, and this is how it can be prevented. So I'm like, I need to be a teacher. So I was actually lucky that when government scholarships came out and I had filled in my education, I actually found that I had gotten one, and actually from Bara University. But then when I was, taking through, I realized that going through with my course, I realized that I may only be limited to a classroom, and I may not be able to get a chance to, engage the out of school in some sort. So it's how I came to unfold myself into now doing real public health at a master's level. So that is so that I could, get a wider platform and a wider reach to the community to be able to share my knowledge. And that's why, for me, a week does not end when I've not talked about HIV. No, at least because of the past experience. Although there are a number of thematic areas, I talk about vaccination, I talk about, but the whole thing stemmed from one experience, personal experience about HIV and how it took the life of my brother. So I said, no, I need to really take it up and make sure that, I communicate something about this disease. So that's how the whole kind of education started, and that's how it actually translated into public health that I'm practicing now.
So in other words, the personal tragedy, and you and I share that. My brother also passed away because of HIV/AIDS. So when I wrote the first book, A School for My Village, I let people know that the work I've done for many years was inspired by his death. So there you are, you and I share that. But at the time of the death of your brother, where you were young.
I was young.
You figured, if I take up teaching, then I can educate more people. They can understand where the diseases are coming from. And at that point, you couldn't even anticipate getting into Mbarara University to become a teacher, that you end up doing public advocacy and public health care. What did the masters add on your skill set to be able to do what you do now?
Of course, with masters in public health, there's a little more that you delve in, especially to do with the community, specifically community engagement.
Okay.
Community engagement for disease prevention. And then how do you communicate? Because actually, health communication is not like journalism.
Okay. Tell us more.
Health communication, first of all, what is the problem? It's very important. And who are you going to communicate to? And why? So there are very important W's that you have to really put in the mind. The way a journalist will communicate is not the way I'll communicate. One, I'll put in mind the socio-cultural context, the religion, the age, okay, the background, a lot of factors that I consider. So with the masters, you get to understand the clear packaging, the information packaging. Have you understood the community you're going to communicate to? Okay. Have you understood the emotional settings? What are those standings that you need to put in mind? So a master's actually gives you logic to do health communication.
Share some of the examples that you have gone in a community and talked to people, whether it is a disease, whether it is a story that stands out for you that you would like to share the public while you are doing healthcare communication.
There are quite many, but I'll cite some of them. I think the most recent was when I was the more recent Ebola outbreak. I'm glad that I was part of the risk communication and communication and engagement team supporting the ministry and the different partners. It was interesting to find that the perception about Ebola was that it is a government setting, it's a government concoction, it's a government kind of is it call it bioterrorism or something?
Okay.
Put up to scare away Mubende residents so that the government can mine the gold. Now,
that was a perception on the ground.
That was a perception on the ground. That actually government, there is no Ebola. It's not there, and this is just a government creation. And they want to chase us from, first of all, our fertile land, and also our gold in Mubende mining areas. Okay. So, as a health communicator, first of all, that's a rumor, that's a misconception, that's a myth.
Okay.
First of all, using the epidemiology, because health communication uses data.
Yeah.
How many have so far died from the virus? Is the data variable? Yes. Bring it on. Let me have it. People, this is a relative of your neighbor. This is your neighbor actually has died. Have you seen? Haven't we buried someone before? Yesterday, the other day? Someone will say, yes. Oh, you're believing now the disease is there? Now we are trying to raise what we call risk perception. What is the likelihood that you're actually going to get infected and die? So you construct a narrative and actually a belief basing on the evidence that actually the disease is there, basing on the data and the events that have happened. Someone has died. So you actually demystify the misconception and the myth that the disease is actually just a government creation. So it was an interesting kind of experience, and really I couldn't see Ebola be declared over. Otherwise, it was not an easy intervention. Maybe another last one was in Chotera around 2019. We were actually on measles, rubella, and comorbidities. Someone may be having their own diseases, and then when you vaccinate them, other diseases may come up. Not necessarily because the vaccination is the cause. Someone may be having their own disease. So the child was vaccinated with measles rubella vaccine, and then the child got some wounds, got some some swellings, and then the parent went to police and said that government has, in a sense, killed their son. Yes. Actually, okay, so Then, of course, we do what we call diagnostics and then examinations. But anyway, to cut the story short, the child had their own illness, and it was not because of the vaccine. Good enough, the child survived. So basically, there are so many scenarios that I've interfaced with in the community that really need serious public health communication, and that's why I'm in the field.
So, in your opinion, do you think that we have enough public health educators to address the needs of the government or the needs of the people? Or is there still a huge need for more public health educators?
Thank you so much. You see, government so far, it has a department in the ministry, Department of Health Promotion, Education and Communication, with less than 30 staff.
For the population of 46 million people?
Yes, of course, they are supported by district health educators, but one district has one health educator. That is not enough human resource.
Yes.
You see, you cannot have, talk about the VHTs, community health extension workers, 2 per village. But remember, how many diseases we have so far? You have malaria, you have HIV, you have the pandemic COVID, you have other emerging diseases. Now, do you think there will be effective health communication with the limited human resource? No. Actually, we need to have serious investment in public health education, because I can tell you, clinical medicine has got some quite good investment. We have the medicines, we have some supplies, but why do we still have HIV when the condoms are in place? Health education.
Yes.
Health education, behavior change, risk communication is what is lacking, and we need more human resource. That is why people like us are really trying to really put energies, put efforts to make sure that we communicate for health, because it is the only way that we can eliminate some of these diseases, if not all.
Very good. Well done. And so, since we need so many, the government is not able to provide all these 30 people for 46 million people, and then district workers. I am from Kanungu district. That's where I was.
Wow.
I have never seen any district health educator in my community doing the work. Once in a while, you hear a small program, once you hear this. So the work that is done by the civil servants, government workers, has to be complemented with community-based organizations, non-profit, non-government organizations, and big NGOs, the Plan International, the Save the Children, and UNICEF.
Absolutely.
You decided with a team of few people to establish an organization and do this as a non-profit organization. What has been your challenges doing this work, and what are your future plans in doing this work in Uganda?
Thank you so much. Truthfully, the challenges are enormous. First of all, one key challenge that people think you have a lot of money, and when you engage a certain district health officer about maybe doing a dialogue, community dialogue on teenage pregnancy, like we have previously done in Mayuge, actually Mayuge, Uganda, and some other areas, you're trying to bring on board the communities for to generate local viral solutions to a certain problem. But when you write a letter, asking for certain engagement, they will say, literally, do you have some money?
Yes.
Do you have some money? So that breaks down the whole spirit somehow if you're not a strong person. So this whole thing is really, there's a way to stifles the whole spirit of volunteerism. For example, this organization, I have about 5 volunteers. So imagine someone, doing voluntary work, and then, you reach a district, they expect money, and yet, so all those challenges, that's one challenge. Another one, of course, operational resources. You need to move. Health education is not about sitting in office. Like you have witnessed. The other time was supposed to have an engagement. I was in Mayuge.
Yes.
No network. So you need to move here and there. You can't do health education except maybe on Twitter targeting. Of course, if you're to do an all-inclusive health education, you cannot limit it on online. You need to do last mile. Go to the ground. Go to the slums. Go to the refugees. Go to the borders. You've already seen me move around. I am not a person who usually sits because I want to create impact. There's that person who never got a chance to go to school. They want that message.
Mm-hmm.
Okay? I can tell you, someone will fear to ask for a condom. I was interacting with some of my fellow young men in the village. Someone says, I fear to go to the clinic to ask for a condom.
Exactly, yeah.
How now you will not empower this person when you're not in the community. So those are some of the biggest challenges that we have had as Purpose Healthcare Africa.
Purpose Healthcare Africa, the challenges are enormous. The government definitely can help with the corruption and asking government officials asking bribes. Government officials watch this channel, so there is your note.
Thank you.
As a public health specialist, what do you find more rewarding about your work? And are there some particular stories you can share, success stories that stand out? The challenges are enormous, resources are scarce. You have corruption happening here. You have misconceptions. People think that the vaccines are going to kill them, but you continue to do this work. What are the success stories, and what do you find personally that is rewarding about doing this work?
Health education really aims at behavior change. Maybe to some, just to use a simple word. If someone has been living a risky life, for example, taking drugs, engaging in risky sexual behaviors, most currently, someone doesn't want to get vaccinated from COVID-19 against COVID-19.
Yes.
If me, I don't know, just because I've not been able to, record some of these voices, and me are telling someone go and get vaccinated, and they just come to the site, that is rewarding. We were in December, we were in Chibuku doing an HIV awareness outreach.
Mm-hmm.
And one young man said what he knew actually, yet it was not actually right, that for him, he knew that having sexual intercourse at midnight doesn't risk him to getting HIV because the virus is asleep at that time.
Wow.
So a mere correcting that misconception and misinformation rewards me. Someone saying, oh, that is it. That is rewarding.
Yes.
The mindset, the attitude, the myth. When I clear that kind of thinking, that is my reward.
That's your reward, and that's what keeps you moving.
Absolutely.
You can go as many miles as you can. You are one person. You said you have several volunteers who work with you. What are some of the key strategies or best practices you recommend for people who are doing this work for effective communication, engagement with communities? People who are listening here who might not get a chance to meet you, Daraus, who are in Pokoto or Karamoja, Moroto, Manungu, DRC, Kasese, where we just lost some children in schools. What key strategies or best practices should these people at least know? 1, 2, 3 to help them. I might never meet you, your organization might never reach here, but at least now I know these 3 things that I can use and practice in my community.
Yeah, thank you so much. Best practices for effective health communication and community engagement.
Okay.
Local influencers is very key. I can tell you every community has that person they respect they value, they hold in high regard, and they will listen and adopt a behavior if the person speaks.
That's one thing any community can adopt and get information there.
2, tailor the message. 1, to the age, to the social cultural settings,
Yes.
to the education levels, and many other considerations. So using tailored messages, for example, the language the border you'll use to communicate to a border or to the market vendors is not the language you'll use in a university setting, or the language you'll use in a slum is not the language you're going to use in Intinda center.
I get you. Yes.
Another effective communication is, of course, use of multiple communication channels.
Yes.
I can tell you, I don't know how long I've taken without listening to radio, but 24/7 I'm online. But also there is someone who is not online, but is in the community. So you'll have to go to the community and do some dialogues and do interpersonal communication. So employing a mixed method, a mixed channel approach to health communication is very important. The times. When are you communicating?
Yes.
When are you communicating this? You will not go to Kasese right now and talk about COVID.
Yeah, when people have just lost their loved ones.
No. So I can assure you, your behavior change campaign will yield a no. Will yield a nothing. So putting into context or the timing for the communication or for any behavior change campaign is very important.
Very good. You are absolutely right, Daraus. The effective communication is going to come with intergenerational. When you said the language you use with borders, I was about to say you can't use it with the bazeis, the old men, or what the language you use with the younger women can't be the same message used with grandmothers who are raising children. So that one heart fits all method that many of us tend to think about needs to be cut in pieces and appropriate. And I like also the influencers. You are right. There is always somebody who people will listen to. I'll give you an example. When COVID was at its height in October of 2020, I flew from the United States against many people's advice, because I knew if I get on the radio in Kanunga and speak to the grandmothers we work with, they will listen to me. They had refused to listen. They thought COVID medication has some poison that people want to kill them. The moment I told them, look, I've taken it myself, I've taken care of you for many years, and I encourage you to do it. We could not even vaccinate. We didn't have enough vaccinations for the lines that came. So influence is a key. Appropriate message for different people, use different communication channels. That leads me to another question. As a health practitioner, you are up to date on what methods, what is happening in the world. How do you stay up to date? You did mention already you are always online. You're not listening to the radio, which means you're online. I'm hoping you are not watching Arsenal and Man U. You are learning something, which is how you stay up to date on these things. Share with our listeners how you stay up to date and the importance of reading and staying up to date in your profession.
As a public health specialist and a health communicator, one thing that keeps me informed is research. I cannot spend a day without checking the WHO website, World Health Organization website.
Yes.
I cannot end a day without checking the Africa CDC website, Africa Center for Disease Control.
Yes.
And also the CDC, the America CDC. So those are the channels, actually the platforms that I make sure that I'm I am really in constant interaction with every other time, because an outbreak will be declared by WHO. Whether you want or not, it is a WHO with a mandate to declare an outbreak. And also, besides that, I keep, you see, I follow almost every health channel on Twitter, so that anything that comes up anywhere, be it in Mozambique, because I follow almost all the Ministry of Health in Africa, so that I know what is happening in Kenya. Because you see, some, for example, outbreaks diseases have no borders.
No, they don't.
They don't have. So any you remember the not Mabak, the one that is recently declared eliminated in Tanzania.
You are the specialist. I don't check WHO every day. You do.
No, okay. Yes, it should be that. Of course.
I mean, we have had HIV/AIDS, we've had COVID, we've had Ebola, we've had Marburg, we've had nodding disease.
Yeah, sure.
Things keep coming, piling.
Yeah, it keep coming. So when the disease is in the neighborhood, there's a likelihood that in no minute it reaches your country. So that I keep following all these other social media handles of the different ministries in the different countries. Social media, for example, WhatsApp, all these things can always come up. So you keep checking. And for me, I don't only use, for example, Twitter. My health communication even goes in the WhatsApp interactions.
Okay.
Someone shares something you see that is not factual, you get in to give the correct information. So that is how I really get to update myself on the different health events and happenings in the world.
And you mentioned it. Now I'm going to actually dig a little bit deeper. A consumption of information, including the information we are giving right here, most of it recently on social media are opinions of people. So to you, our listeners, don't just say Daraus said this, TJK said this. Do your research, dig deeper. We've talked about nodding disease. We didn't give you the spelling. We didn't tell you where it has hit. It's up to you, and you have it on your fingertips with your phone. Research more, learn more. This is the tidbits to get you thinking, but also to dig deeper. The Twitter that I will release tomorrow morning might say, keep your relationships close because they will build you stronger. You want to learn more about it. This is why I read blogs. This is why I write books. This is why I give speeches, so I can learn, continue to learn and expand. So use multiple sources, but also check the facts before you go spreading it, not knowing where it is going to go. You are a young person yourself. My nephews and nieces, some of them are older than you. I've hosted some of them here on this channel, so I've hosted younger people, younger than you. What advice would you give to your younger self? You are speaking to you now at age 18 to 21. Knowing what you know now, what advice would you have given your younger self?
For me, I'll give an advice in line with my area of expertise. That is disease prevention. I can tell you, to our listeners and viewers, I can tell you, I will use a simple proverb. I think it's a proverb. Prevention is better than cure.
Yes.
Very simple and very direct. It is rather very better. For example, just go to the shop or go to the government health facility and request for that condom and put it on. Just give you an example. Than going to the health facility for refills with ARVs.
Well said. Let me tell you, I work with so many young people, and that advice you just gave is so applicable because after COVID, we had so many girls who were pregnant. We had so many boys who pregnanted girls. In your health education, I want you to begin looking at the consequences of a boy pregnanting a girl. The girl drops out of school. The Chijana boy continues in his school. We need to find a way to balance that. If we are punishing one, which also we don't know whether you are punishing whether the girl was raped or consented. But for those of you who are consenting, listen to Daraus. Prevention is better than cure. It's a great advice. I can have a whole episode talking about that specific. People are going for 5 seconds, 5 minutes pressure and paying it for a lifetime, including other diseases, sexual transmitted diseases that will stay with the people forever, including some that can't be identified in men, but they are more in women. People are
and also hepatitis. People should also know that hepatitis B is also sexually transmitted.
There we go.
And of course, hepatitis B at an advanced stage is not treatable. Hepatitis B, to our listeners and viewers, is the disease of the liver.
So that's the advice Daraus is leaving. The advice he would have wanted to have also when he was 18 to 21. When I also ask these questions, I always say, what did I not ask you that you would have wanted me to ask you? That opens a door for you to talk about anything you want to talk about that we didn't talk about before we conclude.
Oh, thank you so much, TJK, and of course, an honor to be invited and be able to share some of the key issues around health communication. Bottom line, what I would say, and what I would really want to emphasize, maybe to government. I would really send this message to our government, and also my other colleagues in the NGO space, and also to our funders, the potential funders, especially for those who be interested in health education.
Yes.
And also specifically taking on the works and appreciating the works of Purpose Healthcare Africa, go on with the mandate of doing a lot of health education across in the different parts of the country. So our government, it is really urgent and very demanding that we do prioritize investments in health education, because it is actually the villages that need us most. They need the services most. This is prevention.
Yes.
We would really do better if we invested more in health education. A lot of finances are being spent on every quarter on procurement of medicines and drugs.
Mm-hmm.
I think we would have a lot of more socio-economic transformation if we didn't have all that expenditure. Just a message on disease prevention would really impact. To our civil society, to our colleagues in the NGO space, I would really request that for those who have not yet really, gotten a lot of programming in disease prevention, it's my call that it's time that they really tried it out, and not actually trying, but give it the attention it deserves. And to our funders out there, on behalf of Purpose Healthcare Africa, we are ready to continue with our volunteerism approach that is really helping us greatly. Yes, we welcome the helping hand so that we save mankind. One message can save a village if we are able to get that hand supported with resources, technical support, financial support, and any other form of support. We would be glad to have this moved.
Thank you once again, the man himself, Daraus Bahikire. Thank you for sparing time and for sharing knowledge and for sharing your passion. And I hope this message goes into your toolkit of the use of information technology to spread the word and to reach as many people as you can. May the government of Uganda continue to work with you and support you and all ministries around. There's so much to be done. There are so few people who are doing it. So if you have not volunteered, this is an urge for you to get into volunteerism, to give back to communities. You can help. Daraus said one of the greatest things for him, which is success, is when he saves one person who thought that COVID is something manufactured to kill you, and now they take a vaccine and they can live. A boy who wanted to go have sex without a condom because he thought HIV/AIDS sleeps at midnight, and now they know, and you save their life. One person, one community at a time. Thank you. Have an amazing evening. We will be in touch. And to all of you who are listening, please continue to subscribe, continue to share, and continue to learn, relearn, and learn and unlearn with us. We are here to give you a free service, which is share the information we get. Thank you.